So, what I want you to understand during this section is what does it mean to age and the difference between aging and failing. Oftentimes, I hear people say, well, they're just getting older. Or when I ask, why are we choosing euthanasia? It is because of age. And that's not very clear. I understand what people mean, but I also want to be clear that aging isn't necessarily suffering. And the problem with believing that it is sometimes we think are just aging. We dismiss things that could be treated with some comfort care, especially things like arthritis. When pets are slowing down, hesitating around getting up or down or going down or upstairs, you see that kind of hesitation, the first thing I want people to stop doing is calling that stubbornness. If you've had a pet that has bounded up the stairs its whole life, and as it's getting older, it's slowing down, it's really easy to just believe they're getting older, they're slowing down. That's what it looks like on the outside. But what's really happening on the inside is, this is gonna hurt. I need a minute. Okay, I'm gonna do it. It's gonna hurt. Or, I'm so excited to go on a walk. I'm walking. This is really starting to hurt. It's harder to push through. I'm going slower. I may have to stop and catch my breath. I may have to stop and you may just see panting. And what do we normally do? Come on, come on. And so what we do in those moments is we miss the communication that our pets are telling us. This hurts. I don't want to keep going. They want to please us, right? They want to be out on a walk. It's way more fun to be out on a walk than cooped up at home. They don't want to give that up. But once they're out there, it might be a lot to endure. Symptoms can be very subtle, and that can give us the illusion that things are just slowly changing, when really things could be changing at a regular rate, but our pets are compensating so we don't recognize how quickly or how badly they feel. Another area besides mobility is eating. We might see them slow down eating. We might see them eat the same but lose weight. And again, we normalize it, saying that's just age. Now, some muscle loss is normal with age, but ribs protruding, the spine protruding, seeing those hip bones, no, that's not normal aging, guys. That's a sign something is going on with your pet. And to be honest, in most cases, that's cancer at end of life. So you want to take these things very seriously. And sometimes that's your only symptom. I know it's a different way to think. As a veterinarian, I've had to do this my whole life. I've had to look at animals and decide what their behavior means about their health. And we're just not used to that. We're used to people who are loud and cry and complain, and that's just not our dogs and cats. If you think about it, it doesn't even make sense in nature that they would draw attention when they don't feel well. Plus, they just have amazing coping mechanisms and compensation mechanisms. So the best thing you can do for your pet, no matter how old it is right now, is to just get to know what normal is. What is your pet's normal? And it's totally fine that your pet's normal is going to be different later in life than earlier in life. Though there's going to be some changes, yes. But I'd encourage you to bring up every single one of those changes, just in case they mean something more when you go to your veterinary appointment.